Now we move on to the second category, viral STDs. Unlike bacterial infections, most viral STDs cannot be cured. Once you are infected with one of these viruses, it remains in your body for life. That might sound scary, but it's important to understand that incurable does not mean unmanageable. We have excellent treatments available that can control these viruses, reduce symptoms, and lower the risk of transmitting them to others. The main players in this group are human papillomavirus or HPV, herpes simplex virus or HSV, human immunodeficiency virus or HIV, and hepatitis B. These viruses work differently than bacteria. Instead of just multiplying on their own, they invade your body's own cells and use them to make copies of the virus. This makes them much harder for our immune system and medications to eliminate completely. They can also enter a dormant or latent state, hiding inside cells for long periods without causing any symptoms, only to reactivate later. This is why they are lifelong infections. The virus becomes a permanent lodger in your body's system. Diagnosis for viral STDs can vary. For HIV and hepatitis B, a blood test is the standard method. For herpes, a doctor can often diagnose it by looking at the sores during an outbreak, but a blood test or swab can confirm it. While we can't cure these viruses, we can manage them very effectively. For HIV, modern antiretroviral therapy can reduce the virus to undetectable levels. For herpes, antiviral medications can prevent outbreaks, and for HPV and hepatitis B, we have highly effective vaccines. Let's zoom in on two of the most common viral STDs, herpes and HPV. Though both are viruses, they affect the body in very different ways. Herpes is caused by the herpes simplex virus, or HSV. There are two main types, HSV-1, which traditionally causes oral herpes, and HSV-2, which traditionally causes genital herpes. The main symptom of a herpes outbreak is one or more painful blisters or sores. These sores eventually heal, but the virus remains dormant in the nerve cells and can cause future outbreaks, often triggered by stress or illness. HPV, or human papillomavirus, is a different kind of virus. In fact, it's a group of more than 200 related viruses. It is the most common STD in the world. Nearly every sexually active person will get it at some point. Most of the time, the body's immune system clears the infection on its own within 2 years. However, some types of HPV are considered high risk because they can cause cancer, most notably cervical cancer. Other low-risk types can cause genital warts, which are non-cancerous